Welcome back. Today we are talking about post-viral recovery, a bit of a hot topic right now, given the circumstances of where we are in the world at the moment. Yes. Welcome back, Kelli.
Hi, thanks.
Okay, as a massage therapist, I know nothing about post-viral recovery, which is why I'm here with someone who has more information than...
Yes, so this is an area that I work with a fair bit. I have a real passion for working with clients in this kind of space, post-viral syndrome, chronic fatigue syndrome, that kind of thing.
You've been on a journey yourself in
and
this regard.
Yeah, and I've had my own personal journey as well that incorporated post-viral syndrome. So yeah, it is a real hot topic at the moment. So I think the dealing with COVID and this new thing that we're seeing with people not recovering well from an acute COVID infection, which is being termed as long COVID or post-COVID syndrome. It's really brought it into the limelight.
Mm-hmm.
Yeah.
So as a massage therapist, I'm seeing people who more and more who have now experienced COVID, and for some people it's just been this mild thing, which it was an inconvenience, they got their week at home. And then for some of those, they go on to talk about these lingering symptoms. Some of my clients have been hospitalised, and there are several now who have been officially diagnosed with long COVID or post-viral syndrome.
Yeah, so it's quite concerning. So the probably most consistent data I've seen is that 30% of people who acquire a COVID infection are going on to develop this long COVID. I've seen some data as high as 50% that's come out of Italy as well, which is really quite disturbing, to be honest, because it can be very debilitating, and it doesn't seem to matter how severe the infection is. So even like you say, some people that have had quite a mild acute infection have gone on to struggle with post-viral issues that could be lasting weeks, months, and unfortunately for some kind of indefinitely as well.
I think one of the common things that I've seen is those who've made their recovery or think they're feeling better, and then just the action of taking the bins out of the curb, requiring a couple of hours rest following that, or wondering why they just can't get back into the activities that they used to do. In the case of one person talking to me about how, as a forklift operator, having to go to his boss and say, I can't remember how to do this anymore.
Yes, and it's very distressing for people. As you know, I'm sure we can all imagine how distressing it is. So I guess the hope in all that is that there are some things we can do to support the body. We're not necessarily going to get people to a full recovery, but we can do some things that can help people at least get back to some level of functioning. And you know, COVID's quite new, but post-viral syndrome is not. So there are people who have been suffering with this type of condition for many, many years before this. Some extremely severe, not able to leave their homes or their beds in some cases, and many not able to work. So we do, I suppose, draw on that knowledge as well when someone walks into clinic and wants some help with getting back on track with that. I suppose it would be good if we sort of describe some of the symptoms and, you know, what people are experiencing as part of long COVID. The key central feature is this, you know, unrelenting fatigue. I think would be safe to say. Usually accompanied by brain fog or some sort of cognitive dysfunction, and then often like fluey aches and pains as well. And also I'm seeing a lot of anxiety and depression that's coming post-COVID. Some people, they've had mild underlying anxiety prior and it's exacerbated, but for some people it's completely taken them by surprise. It's something very new for them.
We talked about anxiety in a previous episode, and there's the inflammation of the brain, and some of the new research that's come out has talked about this aging process that occurs to our brain during a COVID infection of several years.
Yeah, absolutely. And that inflammation driven, so some of the inflammatory markers that are set off and skyrocket during a COVID infection, they are also some that have been identified as being associated with anxiety and depression and fatigue. So that could be part of that causation. The other impact that is probably impacting in terms of the mood and everything actually is the impact that COVID has on our microbiome and our gut health. So it looks like from the current research, remembering this is very new still, that the infection persists in the gut for much longer than it does after we receive a negative PCR test.
I didn't know that.
So weeks to months after, there's still fecal shedding. And it also alters the microbiome, and that doesn't seem to resolve very quickly after infection. So there's a couple of mechanisms that might be at play there. The other things that have been noted in the research is this dysfunction to mast cells. So mast cells are immune cells that are involved in regulating our histamine response. We often talk about them in relation to allergies. And so we're getting this dysfunctional immune cells and histamine dysregulation, and also possible reactivation of latent viruses. So reactivation of Epstein-Barr virus, which commonly is known to cause glandular fever, has been the main one that's been identified, but there could be others as well. Like things like Ross River fever and others that are have already got a link with that post-viral syndrome picture.
Yeah.
Yeah.
Let's face it, there's some pretty bad advice out there at the moment, and some of which I'm seeing commonly, particularly those who are trying to return to physical fitness, whether it's being a friend that's encouraging or maybe it's someone that they trust, is encouraging them to really hit the gym hard and try and train their fatigue out of them.
Yes. Don't do that.
No, if you're given that advice, walk slowly.
Walk out.
Yeah,
walk away.
Walk slowly because you may not be able to run at that point.
Yeah.
But yes, that is bad advice, and you will do yourself harm if you try to do these intense activities too quickly.
I think probably one of the key things that people need to understand when it comes to post-viral recovery is knowing what rest looks like, and it will look quite different to what it did pre-COVID or pre-infection. You really have to be very strong on your boundaries and really prioritize the things that you're going to commit to and that you're going to do for that day, and understand that you're going to have to pull back quite a bit for potentially a long period of time. And unfortunately, that's just the way it is. You've just got to give your body that time and space to recover. And in that time and space, hopefully, you're able to do a few things to support your body in that recovery process as well. But pacing, so we call it pacing, trying to listening to your body, but also even more than that, being sort of one step ahead. So you might feel good to do 10 things, but you probably should only do 8, because doing those 10 things might push you over the edge. So learning that and knowing for each individual what that looks like can take a bit of time to become familiar and listen to your body, but it's something that it's really important as a foundational intervention, or whatever the word is for that. Yeah.
I think it's for those who do have some form of post-viral syndrome from a disease other than COVID or some other factor. One of the positives to take away that there is now a significant ramping up of research right now, where previously you may have suffered, and even the great misunderstanding in the community about what something like chronic fatigue syndrome is. Back in the 90s, I remember that we would unsympathetically call it the yuppie flu. It seemed to hit those who were more wealthy, and well, I think those who were not wealthy just got no treatment. Were hidden away. But yes, it was joked about that. That person can't do the things anymore. Really cruel now, looking back at our information of those days, and the discrimination.
It's definitely raised some awareness, which is a good thing, and hopefully some more funding will go into these conditions. But there has been a lot of stigma around these types of conditions, and people often find it very difficult to talk about it if they're a sufferer, because it makes it so much worse when people don't understand or don't believe you. So if you know someone who's either chronic fatigue syndrome or post-viral syndrome, long COVID, whatever it is, really important to just listen and learn a bit more about the condition and be empathetic, because it's any chronic illness is hard, but it just makes it so much harder when someone just is very dismissive of you, and that can escalate the trauma and stress associated with having a chronic condition in the first place.
And long COVID is not isolated to people who've had previous underlying health conditions either. Previously very capable, fit, active and young people are developing post-COVID, long COVID, post-viral syndrome. And the toll of mental health of suddenly, once I was able to do this and now I can only do this, that reduction of capability is a huge impact to life.
It does have a huge impact, absolutely.
Yeah, it's very indiscriminate.
It's any age. It does seem to affect women more than men. That's across the board with a lot of these conditions. And it seems to be more, you seem to be more at risk if you have a pre-existing depression or anxiety diagnosis as well, or any fear-based sort of conditions. I guess the good news with all of that as the research develops and as we take into account our clinical experience and what we've seen in years gone by, is that there are some things that we can do to support our bodies through that process. So some of the things that I mentioned before that may be contributing, like inflammation, the microbiome imbalances, that reactivation of latent viruses, we can work on by using diet and lifestyle medicine, and herbal medicines actually really shine here. One of the things that sets herbal medicines apart from conventional medicine is that we have a number of antiviral herbs that we can use to support that chronic viral infection, but also that are also anti-inflammatory as well. So we can target things in a very holistic way, and support people with some of the symptom management as well to try and get them back on track. So it is generally a long recovery. My post-viral clients and my ME CFS clients, they are often with me for a good 12 months. And unfortunately that's just the way it is. And it's just because we have to set all those little things in motion and give it time and space as well for your body to be able to respond. So I was going to say something else about that and that just left my brain, but anyway.
Even when it comes to injury, we are used to feeling better from things straight away, and for some which is acute, often recovery is quite rapid. But even with injuries, sometimes the rehabilitation process can take several years before that person is able to return to a level of activity which they were more familiar with. Time is a healer.
Time is a healer, and I think when we can address some of those key issues, it's really helpful for people. And using food as medicine as well. Like, this is a really important time to take note of what you're putting in your body, because you have the ability with food to help your body along a little bit. So making sure, I talk a lot about anti-inflammatory diet. I don't know if people know what I'm talking about, but
I think we'll cover that in another episode.
yeah, we might have to actually. Kind of like a Mediterranean diet. Lots of fresh fruits and vegetables and nuts and seeds and eggs and fish.
Food.
Lots of bright coloured foods, those antioxidants. Lots of water, so staying hydrated. And then removing those things that are really going to suppress your immune system and create further inflammation. So alcohol, processed foods that are very high in sugar, basically anything that you buy in a packet or that's pre-made that you haven't made yourself. But using things like garlic. So garlic is antimicrobial and anti-inflammatory and great for the microbiome. Turmeric, again, so lots of anti-inflammatory spices in your diet is really important. Those omega-3s, so the oily fish and walnuts and pecans and chia seeds, getting those in your diet is really important as well. And stress management. The thing that we probably mention in every single episode. Because viruses rely on your nervous system or that stress response for replication. So stress is actually a secret ingredient in picking up infections.
Stress does suppress our immune system.
So you know, all those lifestyle things that we talk about, deep breathing and movement and those nutrients for stress support as well. So I'll often use magnesium a fair bit along with B complex vitamins to support the nervous system. And then your herbal medicines, again, like your passion flower and withania and chamomile and astragalus, I really love for post-viral syndrome because it has both that antiviral and adaptogenic property, which just means supporting the nervous system and supporting the stress response. And medicinal mushrooms I love as well. And they're just really gentle. And they can support those immune cells.
What do you mean by medicinal mushroom?
So there's a number of different mushrooms that have therapeutic properties. So
we're not talking about the blue ones, are we?
No, we're not talking about those. So like reishi and cordyceps and Coriolis, are the ones that come to mind. There's more than that, but many of them have properties that help support the immune system, and some also have properties that help support the adrenal gland or help regulate the stress response as well, and can be anti-inflammatory. So, I mean, mushrooms in cooking is great as well, but once people get to this stage of post-viral syndrome, you're really kind of looking at using therapeutic doses and, you know, to get people to a point of being able to function better.
We might wrap that up. If you've got any questions, again, either pop a comment below or our contact details are in the notes. Get in contact with Kelli, particularly for something post-viral. Contact Kelli, don't contact me. Massage will not cure your COVID.
It will help with your stress management though.
Absolutely it will. We'll see you another